हेलो एवरीवन, दिस इज डॉक्टर जीवेश यादव। तो अकॉर्डिंग टू एनसीआईएसएम सिलेबस हम लोग मोस्ट इम्पॉर्टेंट 17th टॉपिक फॉर यूनिवर्सिटी एग्जाम देख रहे थे। सीरीज को कंटिन्यू करते हुए आज की क्लास में हम लोग 16th नंबर का जो टॉपिक है पंचकर्म का, वो अपन देखेंगे। स्टार्ट करते हैं। तो आज का टॉपिक तो ये है आपका फिजियोथेरेपी। तो इंट्रोडक्शन टू फिजियोथेरेपी डेफिनेशन बताया गया है। फिजियोथेरेपी इज द साइंस ऑफ ट्रीटमेंट बाय एक्सरसाइज, मसाज, हीट, light, electricity, or other physical agencies. Use of drug is avoided. Physiotherapy also refers to a physical therapy involve evaluating diagnosis and treating a range of a disease, disorder and disability by using physical means. फिर यूटिलिटी ऑफ फिजियोथेरेपी। तो यूटिलिटी ऑफ फिजियोथेरेपी में बताया गया है फिजियोथेरेपी कैन बी यूज्ड इन द diagnosis and management of a wide range of injuries, disease process, and other condition including back and neck pain, occupational injuries, amputee rehabilitation, stroke rehabilitation, chronic airway disease, postural problem, arthritis, spinal cord injury, sciatica, asthma management, neurological condition, development and pediatric problem, impaired mobility, incontinence, continence, sport injury, etc. Important of physiotherapy. Physiotherapy is the most commonly prescribed treatment to assist in the recovery of many injury and conditions. Chronic pain, car and sport injury, and challenge with mobility can all be greatly improved with the use of physiotherapy. Physiotherapy is a drug-free health care practice which can be helpful for individuals of all ages to break down the barrier to physical function. It is used in patients pre and post surgery to help people to recover from a chronic illness, injury, industrial or motor vehicle accident, and in age related conditions. Physiotherapy relieve pain, improve joint mobility, increase strength and coordination, and improve cardiorespiratory function. Physiotherapy also play an important role in the health promotion, disability and disease prevention. फिर नेक्स्ट है आपका स्टैटिक या आइसोमेट्रिक एक्सरसाइज। स्टैटिक एक्सरसाइज प्लेस टेंशन ऑन particular muscles without moving the surrounding joint by applying constant tension to the muscles. Isometric exercise can be useful for improving physical endurance and posture by strengthening and stabilizing the muscles. Most muscles strengthening exercise involve moving the joint, using the muscles to push or pull against resistance. However, isometric exercise involve holding static positions for long period of time. There are two type of muscle contraction: isotonic and isometric. Isotonic contraindication occurs when muscles become shorter or longer again resistance and tensions remains the same. Isometric contractions occurs when tensions increase but the muscles remains at a constant length. Many strength building exercise involve concentric or eccentric movement, which are both isotonic contraction तो यहाँ पे स्टैटिकल आइसोमेट्रिक एक्सरसाइज स्टैटिकल static isometric exercise. Static exercise place tension on particular muscles without moving the surrounding joint by applying constant tension to the muscles. Isometric exercise can be useful for improving physical endurance and postures by strengthening and stabilizing the muscles. Most muscles strengthening exercise involve moving the joint using the muscles to push or pull against resistance. However, isometric exercise involve holding static positions for long period of time. There are two type of muscles contractions: iso isotonic and isometric. Isotonic contractions occurs when muscles become shorter or longer against resistance and tensions remains the same. Isometric contractions occurs when tensions increase but the muscles remains at a constant length. Many strength building exercise involve consent, cons, sorry, involve constrictive or eccentric movement, which are both isotonic contraction. Concentric movement causes the muscles to shorten, and eccentric movement lengthen the muscles. Lengthen the muscles. Isometric exercise do not involve the muscles shortening or lengthening. During isometric exercise, the joints are still and the muscles do not change shape or size. Some isometric exercise develop tension by holding the body in a certain position, while other may involve holding weight. Holding the muscles contractions allow the muscles tissue to fill with blood and create metabolic stress on the muscles. This can help improve strength and endurance. Advantage of isometric exercise is that they are fairly easy to perform, usually do not require any equipment, and are easily incorporable into many weight lifting exercise. Benefit of isometric exercise: they are useful exercise for activating many muscles fibers at once. They requires less practice to perform exercise with good form compared with some dynamic movement. They are suitable for people with an injury or medical condition that restrict movement. Some research suggests that isometric exercise training may be an effective way to lower blood pressure. This exercise can improve muscles stability and the ability to hold weight over longer period. Some research suggests that isometric exercise may help with pain relief for low back pain, knee, osteoarthritis, and neck pain. Example: plank, wall seat, glute, uh, glute bridge, dead hang, isometric स्क्वाट. फिर नेक्स्ट है आपका इंफ्रारेड थेरेपी. इंफ्रारेड थेरेपी क्या है? तो इंफ्रारेड थेरेपी में बताया गया है इंफ्रारेड लाइट इज द हीट पीपल when exposed to the sun. The skin naturally radiated infrared heat every day. Low level of vision low level of visible or near infrared light is used for a reducing pain, inflammation, and edema, performing healing of wound, deeper tissue and nerves, and preventive tissue damage. One of the characteristics of infrared light is its ability to penetrate below the skin layers, providing a much greater depth, which is able to effectively provide pain relief. In fact, this invasive, natural, and painless method can provide a vast range of health benefits without damaging the skin through UV radiation. Infrared light penetrates to the inner layer of the skin at about 2 to 7 centimeter deep. Hence, it reaches the muscles, nerve, and even the bone. Many studies have shown that a frequency of infrared light with wavelength from 700 to 1000 nanometer is best used for a healing inflammatory condition. Infrared therapy technology allow people to harness the benefit of the sun without being exposed to harmful ultraviolet ray. Also, infrared therapy is safe and effective without adverse side effect. As a matter of fact, infrared light is safe and is used even for a infant infants in the neonatal intensive care. Infrared light is absorbed by the photoreceptor in cells. Once absorbed, the light energy kick-starts a series of a metabolic event, triggering several natural processes of the body on a cellular level. The key to the efficacy of a infrared light therapy may be nitric oxide, a gas that is vital to the health of the body arteries. Nitric oxide is a potent cell signaling molecular that help relax to arteries battles free radicals to reduce oxidative stress, prevent platelet clumping in the vessels, and regulates the blood pressure. Hence, this molecular enhance blood circulation to deliver vital nutrient and oxygen to damaged and injured tissue in the body. The the increase in the blood flow to the different part of the body makes it possible for a oxygen and nutrients to reach the cell, enabling them to function properly and effectively. Hence, this therapy stimulates the regeneration and repair of injured tissue, reducing pain and inflammation. फिर नेक्स्ट है इंडिकेशन किस में है और कॉन्ट्राइंडिकेशन किस में। तो इंडिकेशन बताया गया है कि अर्थराइटिस हो गया, रूमेटाइड अर्थराइटिस हो गया, बैक पेन हो गया, नेक पेन हो गया, ब्लंट ट्रोमा हो गया, बर्साइटिस हो गया, कार्पल टनल सिंड्रोम हो गया, डायबिटिक न्यूरोपैथी हो गया, इसके अलावा फाइब्रोमाइल्जिया हो गया, मसल्स स्प्रिंग्स एंड स्ट्रेंथ, सियाटिका हो गया, न्यूरोपैथी हो गया, इसके अलावा टेम्पोरो मैंडिबुलर जॉइंट पेन, ठीक है, टेंडनाइटिस, इन सभी में इंडिकेशन है। कॉन्ट्रा इंडिकेशन बताया गया है एरियाज हैविंग लॉस ऑफ सेंसेशन, पेरिफेरल वस्कुलर डिसीज, एंजाइमा, पेप्टिक अल्सर, इसके अलावा पेशेंट्स हैविंग ए हेमरेजिक डिसीज, तो उनमें सब में क्या है, कॉन्ट्राइंडिकेशन है। तो ये आपको ध्यान में रखना है। इस प्रकार से ये जो टॉपिक है वो फिनिश होता है। नेक्स्ट क्लास में आगे कंटिन्यूएशन करेंगे। तो अभी के लिए इतना ही। थैंक यू।